Diphtheria is endemic to many regions around the world: Haiti and the Dominican Republic in the Americas, Asia and the South Pacific, Eastern Europe, and the Middle East. It is extremely rare in the United States and other developed countries thanks to widespread vaccination against the disease. In this video, we will talk about this disease, diphtheria, by answering these questions. What is diphtheria? What causes diphtheria? Symptoms of diphtheria. How's it treated? Is it necessary to take antibiotics for diphtheria treatment? What is diphtheria? Diphtheria is a serious bacterial infection, caused by the bacterium Corynebacterium diphtheriae, that usually affects the mucous membranes of the nose and throat. Diphtheria can also involve the skin, eyes, or genitals, and can cause complications, including myocarditis, which in itself can result in an abnormal heart rate, inflammation of nerves, which can result in paralysis, kidney problems, and bleeding problems due to low levels of platelets. What causes diphtheria? Diphtheria is a serious infection caused by strains of bacteria called Corynebacterium diphtheriae that make a toxin. It is the toxin that can cause people to get very sick. Diphtheria bacteria spread from person to person, usually through airborne droplets, like from cough or sneezing. People can also get sick from touching infected open sores or ulcers. Those at increased risk of getting sick include people in the same household, people with a history of frequent, close contact with the patient, people directly exposed to secretions from the suspected infection site, g. mouth, skin, of the patient. Symptoms of diphtheria. Diphtheria signs and symptoms usually begin 2 to 5 days after a person becomes infected. Signs and symptoms may include a thick, gray membrane covering the throat and tonsils, a sore throat and hoarseness, swollen glands, enlarged lymph nodes in the neck, difficulty breathing or rapid breathing, nasal discharge, fever and chills, tiredness. In some people, infection with diphtheria-causing bacteria causes only a mild illness, or no obvious signs and symptoms at all. How's it treated? This is a serious illness. Doctors treat it immediately and aggressively. Doctors first ensure that the airway isn't blocked or reduced. In some cases, they may need to place a breathing tube in the throat to keep the airway open until the airway is less inflamed. Treatment involves antibiotics. Help kill bacteria in the body, clearing up infections. Antibiotics lessen the time that someone with diphtheria is contagious. An antitoxin. If a doctor suspects diphtheria, he or she will request a medication that counteracts diphtheria toxin in the body. This medication comes from the Centers for Disease Control and Prevention. Called antitoxin, this drug is injected into a vein or muscle. What antibiotic is used for diphtheria? The Centers for Disease Control and Prevention, CDC, recommends either metronidazole. Erythromycin is given, orally or by injection, for 14 days, 40 mg per kilogram per day with a maximum of 2 g/d, or procaine penicillin G is given intramuscularly for 14 days, 300,000 u/d for patients weighing less than 10 kilograms, and 600,000 u/d for those weighing greater than 10 kilograms. Patients with allergies to penicillin G or erythromycin can use rifampin or clindamycin. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share, and subscribe for the HeInfo channel.